Question: are doctors doing enough for their CKD patients in 2024 or is there a little room for improvement? CKD has become one of the biggest health catastrophes in history, and patients say that not nearly enough is being done about it. Many are not impressed with the cutting-edge wait-and-see approach many doctors still use today. Others complain that dialysis hasn't really improved much since when the dinosaurs roamed the earth. But what is the alternative? And guys, if you are new here, my name is Catherine and I'm a doctor in natural medicine, and I've been helping CKD patients improve their outcomes for more than a decade now. And as a naturopath, I'm firmly convinced that when a more holistic, natural approach is utilized, things can go a lot better for the patient. To prove my point, today I want to show you 3 cases in which a natural approach was actually used to avoid dialysis and what the results were. Spoiler alert! Our number 1 for today was not just about avoiding dialysis, but about getting out of it with a natural treatment.
Don't skip a dose.
Now, these are not anecdotes or stories. These are case studies published in medical journals. So sit tight, because by the end of this video, we're going to be able to tell if doctors are doing enough or if we need to start a revolution, or at least a strongly worded letter. Okay, let's kick things off with a fascinating case report of a diabetic CKD patient that was able to reverse his kidney disease with a completely natural approach. Now, this man more than doubled his GFR in just 9 weeks of naturopathic treatment. Yes, you heard that right! As we can see, his GFR went from 32 to 66.
Wow!
And he was also able to get huge improvements in his fasting glucose level and other important parameters as well. This is a case report I've never featured before, so buckle up, it's going to be interesting. It was published in the NDNR, a peer-reviewed journal, and it's all about a patient, John, that was completely fed up with his doctor and his pills-only approach. Why, you may ask? Well, first of all, that approach was destroying his kidneys. Before starting the natural treatment, his GFR dropped from 63 to 32 in just 10 months. His kidneys were on a downhill side faster than a kid on a playground. And poor John, at 62 years of age, was spending more time thinking about his own mortality than anything else. But that wasn't even the worst part. In fact, this man recently lost his job and insurance, and he wasn't able to afford his medications anymore, nor the innovative and super expensive medications his doctor was offering. And I mean, who would want to sell a kidney to buy even more medications when the medications you are taking are already destroying your kidneys? So, of continuing down the path of medical self-destruction, John decided to talk to a naturopath. And I really love the approach this doctor decided to take with this patient. First of all, because she was able to recognize John as a man ready for a change, which is not something anyone should take for granted. I mean, have you ever tried telling someone that from this point on, they are supposed to completely stop eating basically everything they eat and to start following a plant-based diet instead? Not everyone will respond positively to that. And the diets we give to CKD patients, those with diabetes in particular, are not especially easy to follow. But hey, on the positive side, if the patient follows it, it works, and John proved to be a well-motivated patient. We can tell that by the fact that his fasting glucose dropped in just 3 weeks. But you know, following a diet to stop diabetes is only half of the equation when we are also dealing with CKD. In fact, the second step here was for the naturopath to take a look at the medications John was taking and to find out what was causing the rapid kidney damage the patient was experiencing. And John was taking several medications that are either contraindicated or outright dangerous for someone with a GFR as low as 32. His naturopath got him to discontinue many of them as soon as the new diet and exercising regime was starting to work. She mentions in particular HCTZ and ranitidine, and both are dangerous. HCTZ in particular is a water pill, and it can be dangerous because it depletes magnesium and it may make diabetes worse. It can also be dangerous for the kidneys as well. Now guys, I won't go too much in depth about these medications, but not because they are not important. Reviewing John's medications was crucial. It's like clearing out the junk drawer of his health. I actually believe that finding and replacing dangerous medications was a huge part of the success this naturopath had with this patient. In fact, I recently uploaded a video to show you what medications are the most dangerous for your kidneys, and it's up here and also down in the description if you missed it. Now, what this naturopath used here was a holistic approach, which is an approach that looks at the whole person, not just at their symptoms and lab values. And it was exactly what this patient needed. As I was saying, he was not just able to reduce his need for medications and his fasting sugar levels. In just 9 weeks, his GFR went from 32 to 66, which is like saying from risking dialysis to completely forgetting about kidney disease. Incredible! I mean, it looks like in the battle of natural treatments versus doctors, the natural treatments pulled the fast one. Now guys, it would be shameless of me to plug my job as a naturopath at this point. I mean, I've just shown you why talking to a naturopath may change your life. But I recently had an opening in my schedule and I will be able to take maybe 2 new patients for counseling. And the good news is that I will do remote counseling, which is something completely new for me. And I know that some of you are interested because I got a lot of messages asking for exactly that. So check the link in the description if you are interested and send me an email and we can discuss it. Okay, let's take a look now at a case report of a patient that was able to reverse his kidney disease with 2 natural remedies, sodium bicarbonate and niacin. Yes, you heard that right. Our second patient for today was nearing end-stage renal disease, stage 5, and he reverted back to stage 2. Talk about a kidney comeback! But a large part of the study actually revolves around the complaints the patient has about the doctors that treated him before starting this more natural approach. In fact, this is the story of an 81-year-old man who was diagnosed with CKD only when he was in late stage 4 already. Because even if he had received a quintuple bypass and even if he was suffering from pre-diabetes and high cholesterol levels, no doctor ever thought about checking his kidney function. I mean, who needs kidneys, right? And the fun fact is that according to the authors of this study, the reason why doctors forget to check GFR levels is not because tests for creatinine levels are not prescribed. It's because they don't know how to translate creatinine into kidney function. Now, this case study was published in 2021, not in the 80s like one may think after reading this part of the study. But you wouldn't know it from the doctor's approach. Because I mean, maybe I'm too focused on kidney health, but if a patient of mine had heart problems, too high cholesterol and prediabetes, I would for sure take a look at their creatinine levels and do a quick calculation to see if their kidney function is alright. But hey, that's just me. Now, it's worth noting that you can easily calculate what your estimated GFR or kidney function is based just on your creatinine levels and your age. You see, it's a simple internet tool. But apparently, this groundbreaking concept is still a well-kept secret in some medical circles. I mean, you will think this is the kind of stuff people who work with CKD patients every day should know? So, this man has been diagnosed with CKD when it was already too late. He was not given any advice on how to manage stage 4 CKD, and he was suffering from high cholesterol, high serum phosphorus levels, pre-diabetes, and metabolic acidosis. Just wait a little bit and we'll start you on dialysis, was his doctor advice. Yeah, just a wait and see approach. Classic. But luckily for him, he was able to get a second opinion from the authors of the study we are reading. Then he was started on the natural supplements you see here, niacin or vitamin B3. This is, according to the author of this study, the main reason why this treatment worked. In fact, niacin doesn't just help with cholesterol, it also works as a phosphate binder, and that's exactly why this vitamin can save from dialysis. Remember that excess phosphorus is one of the most dangerous kidney toxins, and the patient was also given calcium carbonate antacid pills, which is something I always recommend for phosphorus, and sodium bicarbonate. Now, sodium bicarbonate is a lifesaver because it can neutralize excess acid in the blood, and the results were outstanding. The patient reverted back to stage 2, as we can see, which is like saying he didn't have to worry about kidney disease anymore. So score 2 for natural treatments, I'm guessing. Okay, let's take a look at the study that just like my video was made to prove a point. And the point of this study is that some doctors are starting their patients on dialysis, even if they don't need it. Incredible. It's like putting someone on a wheelchair when they can still run a marathon. But how do you even prove something like that? Well, it's simple. First of all, you take 97 CKD patients with very little residual kidney function and that are either in or right about to start dialysis. Then you give half these stage 5 CKD patients an antioxidant to kickstart their kidneys back to life, and the other half a placebo. And I know that it must have felt really bad to end up in the placebo group. It's like being promised a luxury cruise and ending up on a rowboat instead. Am I right? Because the goal of this study was clear from the beginning. These researchers knew that something was wrong with the dialysis treatment. These patients were doing alright. They recruited them just for that. I mean, that was the whole point of the study. In fact, they only accepted dialysis and pre-dialysis patients into this study if they were still making urine. Okay, now the incredible part. They had 48 patients in the treatment group and 21 of them were doing dialysis. But after 12 weeks of treatment with a certain antioxidant that is extremely effective against oxidative damage, only 12 patients were still doing dialysis. 9 patients didn't need dialysis anymore, which is incredible. And by the way, 81% of the patients in the treatment group had significant improvements in their creatinine levels, even if they were not doing dialysis. So yeah, that's why it must have been so bad to be in the placebo group. But that's how you do a randomized, double-blind, placebo-controlled trial. Placebo groups are particularly important in double-blind studies where neither the patients nor the researchers know who is receiving the active treatment and who is receiving the placebo. This helps to minimize the risk of bias in the results, since neither the patients nor the researchers can consciously or subconsciously influence the outcome of the trial. And there is no other way to get credible results. By the way, this study was published in a prestigious peer-reviewed journal. So yeah, imagine the placebo group thinking, well, at least I'm contributing to science somehow. But of course, the results of this study were not replicated on a larger scale after it was published. It almost feels like they don't want people to get out of dialysis, almost. And now you may ask, how were they able to tell that the patient didn't need dialysis anymore? Well, there is only one way, measuring the urine output of the patient. Do you remember what I was saying about the patients being started on dialysis without actually needing it? Well, the researchers behind this study believe that if the patient is making more than 1,000 milliliters a day of urine, even when taking a water pill, they don't need dialysis. This is why they only took patients still making at least 500 milliliters of urine per day in this study. And if that amount increased to 1500 milliliters with the treatment, the patient was able to stop dialysis. By the way, what they used here is a special form of CoQ10 called Q-gel. They also think that a different form of CoQ10 called ubiquinol should also work. This is interesting because ubiquinol is very easy to find from supplement stores and a lot of people use it. Now guys, a word of advice regarding CoQ10. I strongly recommend CKD patients who are over 50 and those taking a statin taking a CoQ10 supplement. However, I am not recommending CoQ10 as a way to get out of dialysis despite what this study proves. Not everyone has this possibility, unfortunately. And guys, let me know what you think about this whole holistic versus conventional approach in the comment section. And if you want to know more about how not to end up in dialysis, this video up here is for you. And this is all for today. Thank you for watching. God bless you all. Bye!